Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
Breast cancer is the most common cancer in American women, except for skin cancer. Today, there are more than 3.5 million breast cancer survivors in the United States, and that includes women that are still being treated and those who have already been treated. Pretty amazing.
Survival rates for breast cancer are better than ever. That's great news. The number of women dying from breast cancer has dropped over 40% since 1989.
Wow.
However, as breast cancer survivors live longer, their risk of developing other serious medical conditions also increases. And joining us on the phone from Mayo Clinic in Arizona is medical oncologist, that's cancer specialist, Dr. Bassam Sonbol. Welcome to the program, Dr. Sonbol.
Thank you. Thank you for having me.
Hey, Dr. Sonbol. So the good news, a lot of women in this country have survived breast cancer, some 3.5 million. And I think you recently studied a large group of survivors. Tell us about that.
Yeah, that's right. So as you mentioned, really over the last, specifically the 2 decades, we got much better in terms of the systemic therapies, and that include hormonal therapy and chemotherapy for these women. And in addition to that, improvement in surgical methods and radiation. That's why, I mean, we're at a point where I think about it like as a luxury, actually, that we're talking about discussing other causes of cancer, other causes of death beside breast cancer in those women who have the diagnosis. So a lot of women are now surviving more and more. And the question now that comes up, how are these women dying from their diagnosis? So what we did in this study, it's what we call a population-based study, so utilizing one of the databases that are available to look at a woman with diagnosis of breast cancer. So we included almost 750,000, so 750,000 patients with breast cancer that were diagnosed between 2000 and 2015 with a retrospective study and asking the question, what is the most common cause of death in these women? So,
these are all women who had no evidence of disease. They had been previously treated for breast cancer, and they were essentially cured.
Not necessarily. So they were diagnosed. We have the documentation that they were diagnosed, and then we're following along and seeing how are they dying. Are they dying from the breast cancer itself because it's recurred or never cured? Or they're dying from other causes. Are they dying from heart problems or stroke or other things?
All right, and what'd you find out?
So we found out actually that first of all, the most of the deaths that happened are happening really in those women are between the year 1 and 5 from the diagnosis, and we found that the death from the breast cancer is going down as we go away from the diagnosis. By that I mean within the first 5 years or first 10 years of diagnosis, most women, the most common cause of death is actually from the breast cancer. But then when we go away from that, so beyond 10 years of diagnosis, the breast cancer deaths are actually going down. So for example, between year 5 and 10, the breast cancer itself was responsible for death for about a third of these patients. But then we have almost a third of these patients are dying from other diseases that are not really cancer, for example, heart disease and stroke. And then after 10 years of diagnosis, we have the most common cause of death in these women is actually non-breast cancer, so it's not really the breast cancer. Those women are dying from heart disease, COPD, Alzheimer's, stroke, so other causes that we really see in the general population itself. So,
are you able to tease out that the reason why after 10 years post-treatment, the heart disease or the Alzheimer's or the stroke, that those conditions were contributed to because of their cancer treatment? Or is that not the case?
That's a very good question. I think that's one of the limitations to this study and all other studies which are observational, we call them. I mean, we can look at associations, but we cannot specifically say that this is the causality or that this is what causing this, but we can hypothesize and really say, well, probably this is what happened, because one of the things we might say, well, I mean, those patients are dying from the heart problems, strokes, and things like that, like the general population. But what we did is to kind of delineate that whether they are at higher risk compared to the general population or not. We compared those women with women in the general population who do not have a breast cancer diagnosis in the past, and we found that actually, yeah, there is a higher risk for heart disease and stroke in those women. And to go back to your point, I do think, we do think in our team that probably some of those treatments that those women received helped him to kind of decrease the risk for dying from the disease itself, from the breast cancer, but maybe increased a little bit the risk for dying from heart disease and other things.
And do you think you can blame that on the chemotherapy in most instances? Because we haven't, at least up to this point, had targeted therapy where you were just treating the cancer. You treat the whole individual, which is what the term systemic means. So it damages not just the cancer in your breast, but other parts of your body.
Right. So that's in part due to the chemotherapy, because over the last 2 decades, I mean, we just not have just newer therapy. What we also have, we learned more about the therapies that we already know about. By that I mean we know how to optimize therapy. We know that for some women, less is actually better and is not harmful. So we know, for example, anthracyclines, some of the chemotherapies that we've been utilizing in those patients, known as, and some women call them as the red devil, because it's going to look reddish, chemotherapy. So that chemotherapy, for example, is associated with a higher risk of heart problems. So that's why right now we know that in a lot of those women, we don't really need that anthracycline. We can utilize other drugs. Anthracycline is needed for specific population of women. And then, so that's systemic therapy or chemotherapy. And also we learned, for example, about targeted therapy and how to utilize it better. For example, the Herceptin is one of the directed therapies or targeted therapies. We know that it is associated with some heart problems. In addition to that, we know that for radiation, we now know that there were multiple studies looking at how less might be better for those women, because we know that radiating the left breast is associated with a risk of heart problems at the long run. And there have been some studies right now asking the question, well, can we decrease the radiation from, for example, 5 weeks to less radiation? It's called hypofractionation, which is about 3 weeks of radiation. And in some women, yes, we can do that. And in addition to that, for example, utilizing better techniques. For example, in Mayo Clinic, we have the proton beam radiation instead of photon, so that's kind of more targeted, not really causing more problems to the heart. So all of these things really play into the decision process.
So still the most common cause of death 10 years after diagnosis is due to the breast cancer?
After 10 years, no. It's actually
up until 10 years.
Up until 10 years, yes, it is true.
And then after 10 years, a higher risk of death from Alzheimer's, heart disease, and non-breast cancers.
Exactly.
All right. Dr. Bassam Sonbol, thanks so much for joining us. So more women than ever have survived breast cancer, but those women are at increased risk for other serious medical conditions. And it's important information for not only women who have had breast cancer, but also their healthcare providers. Dr. Sonbol, thanks so much for joining us.
Thank you very much for having me.